When we find an abnormality on mammogram or ultrasound or MRI, there's a need to test the tissue so that a determination can be made as to what this abnormality represents. Fortunately, most abnormalities are not cancerous. They are benign, the vast majority. A few of those abnormalities will turn out to be cancer. But the way that we determine what that is that we need to retrieve tissue from the abnormality itself, whether it is a mass or whether they are calcifications or some other type of abnormality seen on imaging studies. There are two ways of doing that. We can receive the tissue and retrieve the tissue in the office as a core biopsy. It's also called a needle biopsy. Or the patient can go to surgery and a surgeon can actually remove that area of abnormality. For the vast majority of abnormalities, we prefer to do these as an in-office needle core biopsy rather than sending the patient to surgery. And there are multiple reasons for that. One is that the risks are lower when you do a less invasive procedure. And a needle biopsy and a core biopsy is a much less invasive and complicated procedure in order to retrieve that tissue rather than actually going to surgery. The actual procedure itself in the office takes a shorter amount of time, so it's quicker. The recovery is also much quicker because it's less invasive. There are also fewer risks involved because obviously going to surgery involves the risks of surgery and anesthesia.